Welcome to Follow the Data. I'm your host, Catherine Oliver. Air pollution is now the second leading risk of death worldwide, accounting for 8.1 million deaths globally in 2021. As the world's urban population grows, it's important for policymakers and citizens to have access to high-quality scientific research that can empower communities and inform important air quality and public health policy decisions. The Health Effects Institute produces a report which provides a comprehensive analysis of data for air quality and health impacts for countries around the world. The State of Global Air 2024 report serves as a key resource for governments and initiatives such as Breathe Cities, informing their work towards cutting air pollution and climate emissions. In this episode of Follow the Data, I sit down with Antha Williams, who leads the environment team at Bloomberg Philanthropies, as well as Dr. Pallavi Pant, who leads the Global Health Program at the Health Effects Institute, as well as Jaime Pumarejo, the first ever executive director for the Breathe Cities initiative and a former mayor of Barranquilla, Colombia. We discuss the state of global air pollution, how policymakers can use air quality data to inform their work towards climate progress, and why it's so important to tackle this issue at the local level. Air pollution continues to be the number one environmental risk for death globally. Tell us a bit more about Bloomberg Philanthropies' air quality work and how we engage local partners around the world to accelerate action to end air pollution.
At Bloomberg Philanthropies, our mission is to ensure better, longer lives for the greatest number of people. And it's impossible to ensure better, longer lives without tackling the problem of air pollution. I think it's an important point that a lot of the exact same pollution measures that can be taken to make clean air are also the things that are needed to combat climate change. There's a lot of benefits to tackling the major sources of air pollution, whether it's power plants or polluting vehicles or waste management or anything else. And the good news is at Bloomberg Philanthropies, we have an incredible network of partners, including really ambitious world-leading mayors in the world's largest cities that are really ready to tackle this issue. The other thing is it's really a personal issue to Mike. One of his very proudest accomplishments as the 3-term mayor of New York City was that he cleaned up the air here to the cleanest levels in 50 years. That was one of the drivers behind, I think, his favorite stat as mayor, that people at the end of his 3 terms lived on average 3 years longer than they did when he took office.
It's just such a pivotal moment. It was such a challenge when he introduced the idea of no smoking laws in New York. There was great pushback and skepticism, but then very quickly people turned around and recognized the benefit. And then there were so many cities globally that reached out to replicate the formula.
Yeah, one of the most ambitious elements of Mike's sustainability plan, Plan YC, included cleaning up the pollution from buildings that were burning very polluting heating oil. So he created the policy framework, the regulations, and importantly, the financing for the Clean Heat Fund that transitioned buildings off of those polluting sources of heating oil and to cleaner forms. That was a benefit that did a ton to clean up the air for the city of New York.
What are some of the most impactful partnerships and projects that have been implemented so far, in your view?
We're super excited about the partners who are here today. Jaime and Pallavi are doing really critical work with Breathe Cities and with the Health Effects Institute. And those are really good examples of 2 of the things that Bloomberg Philanthropies brings and the kind of work we support. We do a ton of work to provide the data. Mike always says you can't manage it if you can't measure it. And so actually providing the air quality sensors and monitors that are needed to identify the sources of the problem and to engage the public in solving it is super important. That's the kind of work that this Health Effects Institute report is really about, showing the extent of the problem, but also importantly, that it's possible to solve it. And so Jaime and the work that he's doing with Breathe Cities globally is really supporting the best practices of high ambition mayors, getting them to do more and better, faster, and then taking the best examples of what's working and spread those lessons globally. We have really loved working with some of the mayors who have a long record of taking on these issues. And those include the cities, for example, of London and Paris and Warsaw. The strong actions that Mayor Sadiq Khan has taken in London to cut the sources of climate pollution and air pollution have actually cleaned up the air in a really significant way. They've cut air pollution in central London by 65%. And similarly, in Paris, Mayor Hidalgo's actions have cut the number of people exposed to the unhealthiest levels of air by 90%. So it's really incredible to see that kind of progress is possible.
Now, it was in 2023 that Breathe Cities was launched by London Mayor Khan, and Bloomberg Philanthropies worked closely to expand on our clean air work with London and other cities. So, Jaime, tell us a little bit about Breathe Cities' 4 pillars of action and how they're helping to support city leaders that are using air quality data and research to create sustainable cities.
When I think of Breathe Cities, I think it is, in essence, one of the most ambitious urban air pollution reduction programs out there. But at the same time, it's a climate change program, and it's an initiative that has 3 great partners. One is C40, the second is the Clean Air Fund, and finally, Bloomberg Philanthropies, which have partnered together to take this, hopefully, to the first 14 cities, but we want to get to eventually 100 cities worldwide, copying our models, learning from each other, and basing ourselves on 4 pillars. One is data. And as Antha said, it is the basis for every good narrative and to make sure that we are making progress. Second is community engagement. We need the people to know what's going on. Air pollution is a silent killer. Air pollution is also a signifier of what is going on with greenhouse gas emissions as well. And if we are able to tackle one, we're able to tackle the other. And we help, and we believe that policy development and technical assistance to mayors that want to make a difference gives them the opportunity to enact change. And fourth and not least, it's knowledge sharing, making sure that what we learn in one city can be taken to the next. And it's not taking a cookie cutter approach. It's understanding the methodology. It's understanding the narrative. It's understanding that communicating properly with the people to understand that they can make a difference. That if we get grassroots organizations to help a mayor that wants to change but is facing political backlash, then we can give him a hand to make sure that he does as Mayor Bloomberg did in New York and literally saves thousands of lives.
Jaime, can you give us an example? Is there a city that comes to mind, lesson learned that worked really well that you were able to share and scale?
One lesson is clearly London, from which this program was born, on a certain partnership between the Mayor of London and Mayor Bloomberg, where they started the first low-emission zone of this scale and size that looked to better the quality of life of our children, of the people that live in the city of London, giving them clean air, but also giving them the chance to live longer years and to help live a healthier life. But in the end, London became an example. But when you extrapolate that to Sofia, for example, where we're also building a clean air zone for transport, we also understood that we needed to take that onto heating as well, because a lot of the household heating in Sofia was made out of coal or of wood. And if we were able to change that and create a low emission zone or a clean air zone for heating, then we would contribute to solving more than 50% of the problem. In this way, we learned from London, but we are also learning from Sofia and taking that to other cities. In Mexico, for example, we're learning that a thermal electric plant that is fueled by fuel oil is actually causing a lot more harm than had been anticipated. So all these learnings and collective sharing by mayors and feeling that they are not alone, that we are in this together and that there is a common place called the planet Earth, that if we work together, we can save and actually impact our citizens positively, then I think we will have made a big difference.
Dr. Pant, the Health Effect Institute is an independent research organization that provides impartial and relevant science on the health effects of air pollution. Why is high-quality scientific research crucial to informing important air quality and public health policy decisions?
When we're thinking about problems of this magnitude and scale, what we need is information and data. for a city's mayor or for a country's government or even for other types of decision makers, making these decisions about how we're going to control some sources of air pollution, how are we going to improve the quality of the air, how do we set the standards for air quality so that we know what we are measuring ourselves against over time. All of that relies on good quality science and science that can be representative of the places where we live and the types of pollution we are getting exposed to. So we have a very good idea. And I think oftentimes high quality science and replicable science and representative science can also be critical, because as we take learnings and lessons from one place to another, we want to make sure that it stands through any questions that come up, any concerns that come up. Often science also gets used in regulatory decision making in the US, but also around the world. So creating data and evidence that can be credible, that is based on the most robust methods available to us, and conducted in a manner, importantly, that is very transparent and open for people to see what the process is. How you come to the results that you come to can go a long way in both building trust in the data and the information and in helping us make the right decisions.
Now, this State of Global Air 2024 report is the first such release in 3 years. Dr. Pant, what are some of the notable findings on how the overall health impacts of air quality have changed since the last report?
This has definitely been a few years in the making, and the pandemic created a lot of questions and also other parallel lines. So the data set that this report derives from looks at a variety of risk factors affecting people around the world, air pollution being one of them, but also thinking about lack of physical activity or the diet or big issues like malnutrition. What we are reporting is that actually exposure to air pollution around the world is now the second leading risk factor for deaths. So for the global population, getting exposed to air pollution is now a huge part of how that is impacting their health, both as they spend their years perhaps with chronic diseases, time that they may not be able to spend productively, but also in a very big number of deaths. For the year 2021 that this report is focused on, exposure to air pollution was linked to 8.1 million deaths around the world. And that's a big number. For the first time, air pollution also got ahead of tobacco, so smoking, secondhand smoke, and the deaths linked with air pollution were higher than that. So clearly, the report is pointing us to the fact that air pollution is a problem that is here, that is now, and improving air quality can help us bring public health benefits. And we showcase a couple of examples in there. I'll just mention one, which is household air pollution. A lot of the world's population still uses solid fuels like wood and animal dung and coal for cooking. And exposures related to this type of pollution over the years have been going down. And as those exposures have reduced, we've also seen improvements in health outcomes. So for children under 5, which are an important demographic for us to be thinking about, we've seen more than 30% reduction in deaths linked to respiratory infections. Even for the overall exposures to this kind of pollution, there's been a big improvement, which is good news on both the air quality and the public health side. But that is also good news on the climate side, because a lot of this residential fuel use with coal and wood and other types of fuels also means carbon and other greenhouse gases being emitted into the atmosphere.
Jaime, before joining the Clean Air Fund as the executive director of Breathe Cities, you were the mayor of Barranquilla. How has your experience as a mayor helped you engage city governments on clean air?
Mayors have to do things and can't sit around waiting for other people to do it, and can't dwell on debate, what others are thinking or saying. We need to actually deliver results to the people that elected us. That's the beauty, and that's the hardest part of being the mayor. A mayor is really the first line of defense in democracy. It's the person that a citizen goes to when they're saying, every day my kid goes out and has to play in a polluted environment, or I want to leave something behind that is better than what I had while I was growing up. And if we don't hear those people, then we're not being proper city officials. And that's why I think we can relate, we can give them the tools, and we can make sure that we are supporting them. And supporting them also means giving them a nudge by helping build community engagement and grassroots organizations. It means giving them the data, but also understand how to feed the narrative so that it can resonate with people in a clear and concise way. It means, in essence, putting people first and putting the world first, putting our environment in the place that it deserves to be. And I think I was successful in doing that because I listened to people, but I also had the tough conversations with them and we reached agreements. Being a mayor, what I can give is a lot of empathy and a lot of knowledge sharing that we can also take from them. True collaboration.
How can we use these new findings from the HEI's State of Global Air 2024 report to inform our work towards climate progress around the world?
Cities can really use the report to understand the impacts of air quality on health and just the both causes of the pollution and the benefits of the action. Jaime said it well in terms of how mayors need data to be able to inspire strong action. And I think his work and Breathe Cities has been really smart about combining this kind of data with public education to make people understand the necessity of the strong actions that mayors can take that then over time save lives, improve cities, make them more competitive places to live and work, make them places where companies want their employees to live, make them places where residents can live happily and healthfully. Cities and mayors also have a lot of power to act on the causes of this pollution. So by understanding the pollution levels and where they're coming from, they can develop sources of cleaner energy, cleaner transport, better waste management, and other policy measures. And also through an educated and engaged public, have the enduring support to keep those policies in place and continue to make them stronger. I think the report really shows the extent of the impact of air pollution on our health. It just makes clear that mayors need to use all the powers they can to act now with their local communities to tackle the problem.
We also learned in the report that increased access to healthcare and clean energy for cooking has led to a 36% drop in household air pollution deaths globally since the year 2000. Based on the progress that's being made, and there are several examples of that, what can we be optimistic about for the future of our climate?
I think some of the work that local governments have done to tackle air pollution really showcase that solutions can happen and can have big impacts quickly on people's lives. Through Breathe Cities, we've deployed more than 1,000 air quality sensors, along with the experts who are analyzing the data and educating and empowering citizens. And that's really served as a way to drive forward these ambitious policies. In the places that we've mentioned, like the cities of London or Paris or Warsaw, we're seeing really meaningful reductions in air pollution over relatively short periods of time. And that equates very directly to lives saved and economic activity gained. One of the numbers behind this data I think is really important, but people are often surprised by, is just the economic cost of this air pollution. In addition to the millions of people that it's killing, it's an $8 trillion drag on the global economy. And so it's just an area where we really can't afford more inaction. But the good news is that with strong policy action, you can make a really big difference in a pretty short amount of time.
Dr. Pant, air pollution has disproportionate impacts on low and middle-income countries. What are some of the factors to consider when analyzing how different geographies are affected by poor air quality?
Whenever we look at these types of global data sets, there are huge disparities at various scales, starting from the types of data we have available to make these decisions. So when we look at certain parts of the African continent or even some countries in Asia, we don't yet have the type of monitoring networks and infrastructure that you would have in New York or London. Continuing on from that, there are also some gaps in health information and how we can use and work with health data. So I think one important consideration, depending on the geography we're looking at and depending on the types of questions we're asking, is do we have the right information we need increasingly, we do have at least some level of information to start making actions. The other piece, which is really crucial, is that the sources can often vary a little bit from region to region. And although commonly they will still be the same, transportation will be an issue, industries will be an issue, waste will be an issue, and energy production will be an issue, or access to clean energy will be an issue. There are sometimes very unique sources that also come into play, and they have to be taken into account for policy measures. For instance, in South Asia, brick kilns, which are very informal, small setups to produce bricks, are a source of air pollution for many countries. And these are seasonal sources, so they won't show up regularly throughout the year, but they burn all kinds of waste. In some cases, they burn low quality coal. So it's a source of pollution that is perhaps unique to certain regions, but an important one to consider. And in low and middle income countries, another big one that often is really relevant is waste burning. Lack of efficient waste management systems can often mean that either people burn waste at localized levels within their neighborhoods, or even as a practice, waste regularly gets burned. And there are some creative solutions which are being tested and implemented. But in thinking about what are the sources that I need to tackle, what is critically important for my city or my country, sometimes those nuances can become really relevant. Often a big constraint for most low and middle income countries, though that is changing in a few places, is access to the right resources and access to funding. Because often, even if I know what the source of pollution is, and I know how and what I need to do, as the person who's making the decision or as the body that is implementing those decisions, I may not have the right funding sources and other types of information available to me. So I'm really excited to hear that the Breathe Cities program is thinking along all of those lines and hopefully will help bring good change.
That's such an important point about financing for the solutions and the kind of collaboration that's necessary to use this data to make a big difference. One of the great examples from our partners at C40 Cities Climate Leadership Group is in Latin America. They've been able to look at the air pollution levels, identify that transportation is the major driver in these Latin American megacities, and then begin to design the bus rapid transit systems, increase public transportation, and then bring public and private sector finance to those solutions to scale them up really quickly. So it's a cool example where philanthropy dollars can be nimble and quick and try new things out. But then the point is, to get to the scale of the solutions we need, you really need government funds long-term for these programs, as well as opportunities for the private sector. And then the solutions just take off and spread quickly and widely because the benefits are so apparent and obvious.
We also learned in the report that approximately 1 in every 10 people exposed to unsafe levels of air pollution lives in extreme poverty. What role does socioeconomic background play in determining the harmful effects of climate change on households?
More than 2.6 billion people are living in cities that exceed the World Health Organization's guidelines, as have been said by the report, and is maybe not something that many people are aware. As Dr. Pallavi said, it's the second cause of death in the world right now, and we are just not taking it into account on many of the policies that are written and many of the actions that are being taken in the world stage. So I think the first thing is to raise awareness that this does disproportionately affect cities and countries that are in development. Also, that because of climate change, when we have heat waves, the air pollution is exacerbated. So this particulate matter that is floating around in our air becomes more dangerous when we have heat waves and we can't adequately find shelter. Who can't adequately find shelter? Who doesn't have purification filters? Who does not drive around in a car that can recirculate the air and clean it? It is the people that have less resources. So yes, it is a problem that affects people disproportionately when they lack the resources. And also, it is a problem that affects countries that are in development and have fewer resources to tackle the problem. So our work is to first show that there is a problem and raise awareness. Second, get the data out. And third, help build policy. Breathe Cities can become a catalyst. Because once we drive policy and raise awareness, and once we are very efficient with the resources that we use, that can then lead to billions of dollars of the green economy. So we're changing our narrative and we're talking about sustainable heating. So that's the change of old burners to new types of efficient and green-powered burners. It's talking about sustainable energy and changing a lot of the energy that is used in the global south to better types of energy. It's talking about sustainable transport. And all of this creates formal jobs in a thriving economy, and it helps us build equitable societies and a just transition.
Dr. Pant, how can cities best use this report? And what are your hopes on how the data here, the lessons learned, can maybe help reshape their role in addressing and mitigating some of the challenges that we face?
There's 3 points I'll make. One is this report, since its inception, has been designed and hopefully it communicates this message of where are we making progress and where are the areas where we need to still pay attention. Where have things worked? Where we've seen progress and what has that progress meant? Because often implementing solutions requires us also to think about what is this going to mean for people? What kinds of impacts will it have? And are they going to be meaningful enough? The data we showcase in the report highlight that we have seen meaningful progress in some places, which not only gives us hope that we can work towards the cleaner air that we all want, but also that there are examples and success stories to take lessons from. The second point is how significant the impacts of air pollution on health are. This is not just a problem that impacts some of us in certain places. This is a problem that impacts people across the world. It disproportionately impacts those that have fewer resources, but it really impacts everybody. And therefore, the solutions that will work are those that will allow us to just reduce pollution levels. The third piece is the critical part around non-communicable diseases, the chronic diseases, which are rising in general. And there is starting to be a lot of attention around how do we mitigate that growing risk in countries at city level? How do we design public health policies? And the report and the data we have in here shows that when we think about non-communicable disease mitigation, when cities and countries are thinking about their health policies, not just their air quality policies or environment policies, air pollution needs to be a critical pillar. We say this in the report, nearly 90% of those 8.1 million deaths around the world are linked with chronic diseases, heart diseases, lung cancer, stroke, diabetes. So this has to be an issue which is not just thought of in terms of how do we improve air quality and what are the air quality policies and changes, but also what are our health policies and how do we integrate this more across the decision-making that happens at the city level, all the way from urban design to transportation solutions to heating and energy solutions to health policies, and then the same thing at the national level as well.
So in closing, we're going to do a lightning round, some reflections on a data point about air quality that you think our listeners should be aware of. And Jaime, we're going to start with you.
If we're able to reduce 30% of our air pollution in the cities we're impacting, we're also going to reduce around 30% of greenhouse gas emissions and carbon emissions in those cities. So if we're able to get to our goal, then we will have made a dent in quality of life, but also in the fight to save this planet.
Dr. Pant?
This is somewhat of a shocking and a hard statistic, but in 2021, we had more than 500,000 deaths in children under 5 because of lack of access to clean energy solutions, because they were exposed to household air pollution. This is a problem that is important to solve from both air quality and climate change perspectives, but also because more than 500,000 deaths in children is too many deaths.
And Antha, how are you hoping that cities can best use this report?
A really stark number from the report was that 99% of the world's population lives in places with unhealthy levels of particulate pollution. That's really stunning at a time when the solutions are available. We know what we have to do, and we just have to do it. There's so many reasons that have been articulated here today about why action is so urgent. But the fact that we face the existential threat of climate change and the things that we need to do to cut pollution and solve that problem are the same things that are going to save many hundreds of thousands, if not millions of lives. We just have to act. That's it. We just have to do more fast.
We hope you enjoyed this episode of Follow the Data. Bloomberg Philanthropies is committed to engaging local partners around the world to accelerate action to clean our air. Many thanks to Antha Williams, Dr. Pallavi Pant, and Jaime Pumarejo for joining us. As always, the views of our guests are entirely their own, and Bloomberg Philanthropies hasn't independently verified any of the statements made by this episode's guests. If you haven't already, please be sure to subscribe to Follow the Data. This episode was created by Arden Lieb, Devin Alessio, Minnie Kim, Eli Metzger, Marshall Cohen, and Penelope Hoops. To learn more about Bloomberg Philanthropies' air quality work and broader environmental efforts, visit Bloomberg.org and follow us on X, Facebook, Instagram, Threads, LinkedIn, and YouTube. As our founder, Mike Bloomberg, says, if you can't measure it, you can't manage it. So until next time, keep following the data. I'm Catherine Oliver. Thanks for listening.